Today's video is on a self-correction technique for a hypermobility of the SI joint or for pelvic obliquities. Most patients know that they have a pelvic obliquity, and it typically occurs when you either step off a step the wrong way, sprint or run. If you're an avid runner, sometimes you have a hypermobile side or a stronger side, which will then pull your pelvic ilium out of alignment. So I will show you how to self-correct. So most people will know when they have a hypermobile side, they've been to therapy before or a chiropractor before and have been told that they have a hypermobility or that they tend to rotate out. Typically, if you're right-handed, you tend to have an anterior rotation on the right-hand side, posterior rotation on the left-hand side, but not always. So a lot of times people need to check with their PTs or chiropractors about which way they typically rotate out. So I like to use a dowel. I have this small foam roller that I use for this, and I typically have an elongated leg on the right, posteriorly rotated ilium. So I want to anteriorly rotate my ilium. So what am I going to do? I'm going to put the dowel under my left and over my right. Bring the legs up to a 90-degree angle. You want to hold on to the dowel tightly with your hands, and then you're going to push your left leg away while you pull your right knee towards you. You're going to hold for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and relax. And then we're going to do that again. So we're going to do this 3 times. 2, 3, 4, 5, 6, 7, 8, 9, and relax. Good. And then one more time. 1. And this is sub-maximal, so about 50% of your strength, or about 3 to 5 pounds of force. You're not pushing as hard as you can because you don't want co-contraction. You just want hip flexor activation on the right and hamstring activation on the left, and that's about 10. Good. So you're going to put that aside, keep your knees bent, place your feet on the floor. Take your strap. So you can use a belt, a strap, a dog leash, a sheet, and you are going to wrap that around your thighs, crisscross it tight as you can, your legs stay together. Hold on to those loops as tight as you can by your side and push your legs apart. Count 10. 1, 2. So you're activating your abductors and external rotators. That's 10. And again, we're going to do this 3 times. So you want to be holding the webbing really still so you're not getting a lot of motion here. It's an isometric contraction. 9, 10. Good. And then again, push out. And you want to try to keep the rest of you in neutral. My low back is in neutral, not pressing my spine into the floor. My abs are somewhat contracted, but not super tight. Good, and that's 10. And then you're going to get rid of the strap. And you're going to grab a block or a bender ball. So I've been using the bender ball lately. But if you don't have one, you can use a yoga block or a pillow or something firm. You're going to place this the narrow way between your knees, and you're going to give yourself a push. And then you just heard me pop in place. I don't know if anyone heard that, but I just popped my pubic bone back in place. Count of 10, and then relax, and then again. So I have a hypermobility, and that's because I have a scoliosis. So I tend to rotate my pelvis out pretty easily. And so this is something that I do frequently, maybe once a week, to pop myself back in. And you want to do this as hard as you can. You're squeezing that block as hard as you can with your adductors. And you'll pop that pubic bone back in, and then you do one more time. And then the last one, I like to lift the hips up into a bridge. Squeeze, 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 and then lower down. Perfect. Take that out, and that's how you do the self-correction technique.